It's my feel-good breakfast show.
Introducing new PANADO Pediatric Syrup 5ml sachets. They're really convenient to pack and easy to use, so you're always prepared for pain and fever, anytime, anywhere.
Welcome back. Thank you so much for rejoining the conversation. We're now going to be talking to parents, and I want you to just take a bit of pressure off your own shoulders. It's important for moms to be patient with yourselves, especially first-time moms. We know this is a crazy gateway to move through. After all, you're learning new things literally every day, probably every minute of those first few days. And one thing that has empowered moms worldwide is good advice. And joining us to discuss pain and fever for first-time moms is someone who's given us amazing advice, Paediatrician Professor Claudia Gray. Prof, welcome back.
Thank you, and good morning.
It is good to have you here. We're often connecting via video, so nice to have you here in person. I love this phase of a parent's journey, especially a mom, because there is so much pressure, yet you've got so much intuitive knowledge, this like tome of knowledge that's just in there, which I want to say to new moms, take the pressure off yourself, because I think there is this expectation that you're going to just smash it, and it's not always like that. When it comes to fever and ailments within our babies, that's when it does get scary though. As soon as that temperature starts spiking, you're thinking, okay, literally looking at the thermometer, is it time to go to hospital? What do we need to keep in mind when that's happening? What generally causes that spike in temperature?
So basically, a fever is a sign that your body's fighting something. It could be inflammation, it could be infection. And really, while you're fighting this, you release a whole bunch of chemicals that reset your body thermostat, so to say, and that manifests as a fever. So it's usually a sign that there's inflammation or infection. Causes of that, well, any old infection can cause a fever. It doesn't have to be serious. A common cold can cause a fever. Teething can cause a low-grade fever, not a high fever. That's a bit of an old wives' tale. Respiratory illnesses, flus, throat infections, ear infections, and then you can get more serious, such as pneumonias or meningitis or bone pain.
Where it can be
very unlucky,
serious,
it can be something very serious like leukemia.
What's normal, and when do we start to worry and seek advice?
Sure, so everybody's got their slightly different range, and that can vary on a diurnal basis throughout the day. It's usually sort of between 36 and 37.2. But when it's over 38, 38.5, then you're thinking, okay, this is really outside of my normal body range.
The body's struggling
and
there.
The problem is, if it goes fairly high, you can feel very uncomfortable, and kids become irritable. They don't want to feed. If it's extremely high, such as over 40, you can get something called a febrile seizure, where the brain actually almost short-circuits, so to say, because of the rapid rise in temperature, and kids can present with a fit.
Okay, and I think that's why often, I mean, that number 40 is in my head still, and my kids aren't that young anymore, but you're still like, oh, I'll be getting close, I'll be pushing. Thank you, I love that, because it's quite practical as well, which is nice to know the zone that you're working within. We've are limited in what we can use to help ease the pain of our little ones, and we know, any one of us who've experienced a high fever and that pain, you know how awful you feel in that moment. Paracetamol can be used with kids. What is the best way to approach that? What should the mindset be when trying to alleviate the aches and pains?
Well, I think the first mindset is treat a fever. There is often the myth that you shouldn't treat a fever because it's actually, you know, getting rid of the infection. Yes, to a degree, it's part of the chemical response, but it's almost an over-response.
The body is still going through something. It's not just a natural, lovely thing.
The body's still got loads of chemicals which are killing your bugs. You don't need that high fever. It's uncomfortable, it can cause complications. So manage a fever if it's high. The child's uncomfortable, they're not going to feed. It's going to be a disaster if you leave them uncomfortable. And then you've got certain medications that you can use, and also from an early age. It's a bit of a myth to say you can't use medications in young children. You absolutely can, in the right dose and in the right fashion.
With the right advice, for sure.
Yeah, so we have a few agents that can treat fevers. Paracetamol is sort of a very trusted and tried and tested and safe, given the right doses, medication. The nice thing about it is it doesn't upset the tummy. So a lot of our anti-inflammatories cause gastric irritation. Paracetamol doesn't, and that's quite handy, because often when kids are sick, believe me, they aren't interested in eating
Oh, for
and drinking.
sure.
So it's a handy way of getting the fever down so that they feel better and then can eat or drink.
That obviously aids the body healing itself, yeah.
Absolutely. And if you rest, you can heal. If you're less irritable and you're feeding, you can heal. The other nice thing with paracetamol is you can alternate it with other types of medication. So you can use it as a base and alternate it with an anti-inflammatory. But I think the bottom line is it's tried and tested through decades.
Chances are your mom's told you she used it, and that's often,
Absolutely.
in most cases, 100% of the time, in fact, for me, an absolute endorsement. But I love that. You want to help treat that fever so that your little one can eat, can rest, can heal themselves, because I think the most miraculous healing happens within the body. But those little bodies, they need a bit of help, and I think the moms need a little bit of help, or probably a lot of help as well. So if you're a mom with a sick child right now, we love you, we get you, we understand what you're going through. And if it is starting to progress beyond what you can handle, ask for help.
Being a parent can be challenging, but stepping out is when things get real complicated. That's why new PANADO Pediatric Syrup 5ml sachets are here to make the job easier. They're really convenient to pack and easy to use, so you're always prepared for pain and fever, anytime, anywhere. PANADO, a dose of care.